we're still forced to interact through general purpose tools and layers and interfaces. My name is Robin Resnik. I have a background from tech. I chose to retrain in medicine. So now I'm combining my two backgrounds in building Humla. So Humla is the interface between the physical world and the users and AI or advanced software. It's the layer in between that actually enables you to use the software in a way that fits your workflow and the conditions in your specific domain. And in this case, obviously healthcare. That's what we're building for.
How big an opportunity cost is it not using these tools?
Well, I think that's a great question. If we take a step back and look at where we are in healthcare right now, it's very challenging. We have the demographic shift. We have lots of other challenges, of course, but we're in a situation where we have to produce more with less. And I think the only realistic solution to that is by increasing efficiency and quality and safety through advanced software. I think there's one. You asked me about if we received any skepticism or pushback. I think one question that we've gotten, but that's mainly from investors and kind of really tech interested clinicians, is like, oh, so you're doing this AI pin kind of thing, why? How will you succeed where it has failed before? Because there's been some historical venture-backed companies that's been trying that, but they haven't. So our take on that is that they have addressed general purpose use cases, like where's the closest restaurant, as a private individual or as just a human being. So they haven't really addressed specific professional workflow friction.
If we start introducing AI as a concept into clinical workflows using general purpose models, we'll start getting friction as well, because it wasn't built and developed for that particular space. It'll probably get by, but will it be good enough? It will probably be, to your point, the same as using a general purpose cell phone for, whatever it might be that has a high clinical barrier. That's been the premise all along.
I like that phrasing. There's friction with general purpose tools, so we're building something purpose built. And I think the same goes for Corti, right? You're building your LLM and your infrastructure specifically for healthcare.
Can you talk a little bit about using general purpose, whether it's tablets or phones, any type of device in healthcare that wasn't built for that purpose? What does that friction look like?
To quantify that friction, and that's what we do when we build our interface, requires you to understand which types of resources are being used to utilize each specific device or interface that you mentioned. So we have, of course, hands, we have arms, we have our body, and we have our physical location. We have all of our senses, eyes, voice, of course, ears, cognition. All of these are resources that are scarce and that we need to take care of. We need to direct them to where they produce most value. And with the smartphone, we have to use all of them. And with the Humla, we minimize them to the extent that some of them we won't have to use at all. And I think for many of the applications that Corti enable, we really want a context-aware and proactive application where we might not be the ones initiating the actual mechanism. We're prompted before we know we're actually supposed to do something.
Can you walk us through your sort of ideal version of that, where you're sort of like showing Humla off to the broad healthcare sector with the demo, where you feel like this is the one where everyone just sees that their world has changed? What could that look like?
A healthcare professional gets access to the best intelligence capacity within your domain, and that is kind of provided to you throughout your workday without asking anything in return. So you get all of that potential efficiency gain, safety, production gain, without causing any friction in your workflows, no compromise on hygiene, no compromise on privacy. It just sits there and provides you with value throughout your day. And it's proactive and context aware.
Yeah.
So you might go into your emergency room and do your thing, and Humla will know where you are. It'll understand the context, and it might understand that you're tired today and that you're not making ideal decisions. And it might understand that and prompt you with maybe warnings or tips, or it might actually call for support.
What's sort of the natural barriers to get to that reality where you're able to do that?
I think technically there's not too much to worry about.
No.
I think it's more of a kind of getting the integrations in place. And I think changing behavior, which has been, I think, historically a big barrier, and especially within healthcare, becomes less and less of a barrier. I think people understand that this is the solution and that they see that it improves their workday. So I think we feel that adoption goes quite smoothly. And when it comes to integrations, which has historically also been kind of a major hassle, of course, not only with EHRs, but definitely towards EHRs. That's kind of up for discussion. Like, what will an integration look like in the coming years? It will likely not look like what it has been for the past years.
What does Humla look like, and just in general? So, what kinds of companies do you think are going to create this positive change?
I think from a workflow perspective, we need software to solve more problems for us. So in that sense, we need more applications. But from a kind of clinic user perspective, we need less. We need as few touch points as possible for many reasons. But when it comes to functionality and features through Humla, I mean, the scribes are now like really picking up its pace, and we're seeing some really strong adoption there. And that's been our starting point with Humla to be the mobility strategy for scribes. And as we see kind of that long tail of more and more features being adopted, we want to cater to those as well. And of course, like real-time decision support, resource optimization tools. We of course want to be the kind of interaction layer to EHRs where it makes sense. If we are that purpose-built interface for healthcare professionals that travels with them seamlessly throughout the day, it makes a ton of sense for us to also enable less advanced features like alarm, translator. As soon as we get that volume of distribution, I think there'll be so many interesting things that we'll be able to enable that is really needed.
There are so many challenges, and some of them are very specialty specific or context specific. Sebastian, you were talking earlier about, I think, with some of the long form psychology consultations, they're just so different. Even scribes themselves need to be at least configured very differently, if not even developed differently. And the idea that all of that's going to be serviced by the handful of big EHR systems that we've got, or big technology providers, and other established health tech organizations, and that general developers, can't get involved. To me, that seems like one of the barriers to being able to solve this stack of problems.
I think you guys are really addressing that. Your strategy has been really interesting. I think, like, as I've understood it, at least, you've taken the kind of infrastructure, the kind of plumbing route, rather than pursuing your applications of your own. So you're kind of leaving that layer for other companies to build, which of course streamlines everything and provides potentially just one integration, or at least less number of integrations for application builders and EHRs and any healthcare operator, really.
I know you also have some thoughts about, in general, what the kind of macro problem we're trying to solve is and what the nature of an interaction between, healthcare professionals and these solutions are. Can you just try and talk a little bit about the way that you think about this space in general?
Sure. So I think the way I look at this is that we're born into this world with the central nervous system. And this central nervous system wants and needs to interact with the physical world, and it does so in a natural and direct way. But when we talk about interaction with digital domains, we're still forced to interact through general purpose tools and layers and interfaces that really forces us to adapt to technology and not the other way around. Like smartphones, they're built for consumption. Tablets, they're built for entertainment. Desktops, they're built for office work. And they require so much of our resources that I think we'll look back to this point in time and think, how did we ever put up with doing so much work for the machines?
Mm. What do you mean by that? Doing so much work for the machines?
Well, we're basically doing their work for them. That's how I think we'll look back at this point of time. I think there's a natural bias where we always compare to where we've been before. Like it's always an improvement. The smartphone is a great device when we compare to what was before. The fax machine was also fantastic when that came. But if we kind of start with a clean sheet and envision what could we actually have if we build something from scratch, tailored and purpose-built for the specific workflows that we want to address, then we'll end up with something completely different than what we have today. I think we shouldn't be naive. It'll be a lot of hard work to get this to like really massive distribution, but we've already come far. We have like a core part of the tech already in place. We're enabling already now scribes and decision support and a whole set of applications that works on our platform, combining the hardware, the sensors and the firmware and the software to solve these problems in a way that hasn't been solved so far.
How do you test these things? What does it look like in terms of having users, healthcare professionals, and setting and so forth?
Humla is already being out in the market now. Yeah. It's being paid for. It's in pilots. So we get lots of feedback from users. Like really try to quantify how much of the hands, how much of the eyes, how much of the voice and cognition and arms and physical location is being required or limited in order to achieve a certain function or a certain part of the workflow.
You brought the device, Robin. I don't know if it makes sense for this format, but
let's have a look. Yeah,
I think
let's look at it.
It would be good to get a.
This means doctor in Swedish, läkare, and this is not our latest iteration actually, because our latest iteration is being used in clinics.
Right.
But
where it should
be. The form factor, as you can see, is built into the name tag or the doctor's badge. It's multimodal on the input and output side.
What does this look like in 5 years or in 10 years?
I think when we think about the form factor and the interaction design, we have to decide how deep into the workflows do we want to go? How much of the workflows that right now happens in front of larger screens do we want to absorb with this? And that has implications on our form factor. And we want to take a step in. So it will not look exactly the way it does right now, but likely pretty similar.
What's surprisingly difficult, or what's the kind of the unusual challenges associated with this, like manufacturing or bringing things into an environment? Like you've had to learn about some things that are not really just the technology in order to have that sitting there.
Well, I think what surprised me a little bit is like how much of these weird parts of the workflows that you don't think of when you think of a microphone that is supposed to work with a scribe, for instance. Now, that's just one of the applications, of course, that we're working on. But like, if you really work through the professional's workflow, you will find some weird situations that you didn't perceive existed, and it really hurts your head when you try to like envision these weird combinations of events that will happen, that we'll need to solve in order to offer a robust and friction-free user experience. Then when it comes to like the hardware specifically, I think everyone's so afraid of hardware from an investor perspective. It's like, ooh, hardware, it's not scalable, but
right.
A strong team who has the experience of building things at scale, and it's like that hasn't really been painful. But we do believe we've found a form factor that really solves a lot of issues. There's a trust factor with what we have here, and there's also an emotional aspect of it when it comes to the user likes it, and then it's also the physical location on the human being that's carrying it. That's really a beneficial closeness to the head, and it's staying clear from our extremities. That's beneficial, for instance.
Yeah. We have long discussions about when do you intervene too much and when do you start to negatively affect the behavior of the healthcare professional, or too much automation and that kind of stuff. What in 5 years' time is the perfect support framework for healthcare professionals?
We talk a lot about workflow orchestration and what is the natural workflow of a clinician, and that's obviously something that changes over time. If we did 100% of the workflow, whatever that looked like 100 years ago, now we're doing maybe a lot less than that, obviously.
Right.
And the software kind of replaces more and more of the parts of the workflow that we used to do. It's really dynamic how our natural workflow evolves. Well, it's about like where do humans really add unique values? Kind of where will we be in, like you said, in 5 years or 10 or 20, 30?
Because I don't think it's an easy thing to answer. What we sometimes talk about internally, and there are some researchers at Cordy as well working on this, is that it's actually not obvious that what currently gets bucketed as admin, so like doing documentation, for example, it's not that obvious that that's a purely negative thing. It can be a space where people think through the nature of the case and like consider things they maybe previously hadn't, because they're forced to actually spend some time considering it and typing it out. So completely automating all of that, and obviously the extreme version that some people talk about is, there's like pre-authorization, ambient documentation, everything out all the way through to billing and coding and so forth, and no healthcare professional intervenes at any step. That to me seems obviously incorrect. That seems sort of like obviously flawed. But I'm interested in your opinion also when you think about the future of Humla. How far is too far? Or perhaps on the other direction, what are the challenges we definitely do need to continue to address?
So that's a great question. I think if we start off with what the goal is to really increase output and improve the quality of the output. We want people to be healthy and live longer, more happy lives. That's what we're all like going to work for. The question is who can like enable that in the best way? Is it software or is it humans? And in what combination? I don't know the exact answer. I think it's important that humans are in control. I think we can draw from defense industry where software are to a great extent the decision makers. But we need that level of control, defining what is a value creating task and what is not, multiplying the activities within the actually value creating activities.
What kind of feedback do you get?
So the feedback on the concept and the overall functionality is great. And they love the form factor. And some people think that it's just the form factor that's new about us, but where it's really not. It's the combination of how we design our hardware and the sensors and the software backing it up, and also combining it with the infrastructure layer, just like Corty. They're enthusiastic.
Are you thinking about, okay, how do we do well in Stockholm and nearby, or are you thinking about how this would actually roll out outside of the country?
I think this will happen everywhere. And I think the Nordics is a really good place to start because we trust each other here to a great extent, and we're advanced in tech, which Humla and Corti are both great examples of. And we want to pioneer things, and our healthcare system is advanced. So I think it's a good place to start.